for the next terminology which is related to menstruation, which we'll be discussing, is what's known as what? Menorrhagia. Alright, menorrhagia. Right, menorrhagia. So for this, menorrhagia is just a medical term for what? Somebody's having abnormal heavy, alright, or you're having menstrual bleeding for a very long time, you know. So normal menstrual bleeding should be like this. So if you're having large amounts of menstrual bleeding, then that's what is known as menorrhagia. So it can significantly interfere with your daily life. Alright, imagine you're walking around and blood is pouring out, you know, and maybe a sign of an underlying health issue. Do you understand? So once you see somebody bleeding too much during menstruation, you can now be suspecting some particular disease conditions, which will be looking at their names. So what actually counts as menorrhagia? How do we define menorrhagia? Right, so if you are soaking through one or more pads or tampons every hour for several hours, if there's need for you to double up your protection or the menstrual pad, all right, more than one menstrual pad, you know, you are passing blood clots larger than a quarter, so you are bleeding for more than 7 days at a stretch, that's menorrhagia, right? Or sometimes you bleed to an extent that the blood has to like wake you up in the night because of discomfort, just to change, you know. Yeah, you're feeling tired or dizzy, or maybe shortness of breath, that's all menorrhagia. Now, common causes. Now, these are the things you'll be suspecting if somebody is what? Bleeding too much. So hormonal imbalances, alright, uterine fibroids or polyps, adenomyosis, that the uterine line is growing into the muscle wall, you know. So bleeding disorders, some people, it could be that, you know, their blood is not clotting as it should, you know. So thyroid disease, liver disease, kidney disease. So basically, somebody bleeding too much is so many things are underlying. So you have to now what? Check it out, you know. Certain medications like blood thinners or hormonal therapies. Pregnancy complications, like the person has miscarriage or you have an ectopic pregnancy. That's the pregnancy where it's not typically where, alright, an embryo is supposed to be at. Maybe cancer of the uterus or cervix. Okay. So diagnosis is you are just trying to identify the issue, pin it down. So you do menstrual history tracking, alright, blood test to check if, alright, their blood levels are down to the level of anemia or clotting issues or thyroid function issues. Then pelvic ultrasound, this is where you now want to check if there's any anatomical issue. Alright, then you do a biopsy because you want to test and rule out cancer. Hysterectomy, you want to view the inside of the uterus to see. So treatment options, you know, you are dealing with conditions that could actually lead to inflammations too. So you can give drugs that will stop any inflammation, that's burning of the mucosa, burning of the skin. That's NSAIDs, that's non-steroidal anti-inflammatory drugs. Alright, the hormonal therapy, alright, like birth control pills, you know, you just want to regulate the person's hormone levels. Then tranexamic acid will help to clot the blood again, so that blood is not over bleeding, you know. Iron supplements, if the person is losing a lot of, you know, blood, so they might now lack iron, you know. So surgical options like endometrial ablation, myomectomy, hysterectomy in some severe cases. So that's just what menorrhagia or heavy menstrual bleeding simply means.